Hi, my name is Craig Soriano. I am a student of physical therapy at the University of Pittsburgh, and with the help of Becky Slater and Chelsea Stravinsky, we'll give you an overview of the patellofemoral pain syndrome. So some objectives for today. What is patellofemoral pain syndrome? A few differential diagnoses, how it will present in your clinic, common causes, how to test for it, and how to treat patellofemoral pain syndrome. So patellofemoral pain syndrome is anterior knee pain that usually worsens with activity. It's oftentimes accompanied by crackling, clicking, or locking of the knee, which is oftentimes conditions that are common with other knee injuries, which would lead you to a lot of differential diagnoses. These would include medial plico syndrome, Hoffa-Fatpad syndrome, Pez-Anserine bursitis, IT band syndrome, osteochondritis dissecans or chondral fractures, patellar tendinopathy, or meniscal injuries. Here are some videos what won't be presented as patellofemoral pain syndrome.
That straight path towards the base.
Marcus Lattimore holding his right knee. It was his left knee that he injured last year about this time.
So after watching some gruesome videos, what are mechanisms of injuries? There's muscular imbalances, especially in the quadriceps, which would result in a lateral pull of the patella, altered lower extremity kinematics, especially with the hip or the ankle, that need to be evaluated with patellofemoral pain syndrome, soft tissue dysfunction, altered biomechanics, or direct trauma. Here's a video of what could present itself as patellofemoral pain syndrome.
Stand up or make a call, and then here comes Vitali looking for Como.
Test for patellofemoral pain syndrome. You can palpate the joint, looking for the presence of pain, assess the patellar mobility, which is oftentimes decreased, add compression to the patella, which is positive with the presence of pain, use a lateral pull test, which is positive for an abnormal superior laterally tracking, and use the patellar tilt test, which is positive for a neutral or a negative angle of the patella or inability to move the patella past the horizontal plane. To treat patellofemoral pain syndrome, you can use patellofemoral taping, which would include a medial glide, medial tilt, or medial rotation of the patella. You can also use bracing, which would help with the patellar tracking system. And of course, you can offer a rehabilitation program through physical therapy. During therapy, the therapist will oftentimes focus on quad strengthening. The reaction force in the patellofemoral joint changes through the different degrees of motion of the knee. A rule of thumb, during open kinetic chain exercises, 90 to 45 degrees is preferred, and for closed kinetic chain exercises, 0 to 45 degrees is preferred. Here's an example of a closed kinetic chain therapeutic exercise. A partial wall slide will initiate the quadriceps during the squat, but will not continue past 45 degrees. After the reduction of pain, a form of progress through the rehabilitation program would include leg press. Here, you can increase the weight to increase the strength of the quadriceps. The therapist will also focus on hip strengthening. In a research study article titled "Hip Strengthening Prior to Functional Exercises Reduces Pain Sooner Than Quadricep Strengthening in Females with Patellofemoral Pain Syndrome," one group participated in 4 weeks of hip strengthening, while the other group participated in 4 weeks of quad strengthening. Both groups finished with 4 weeks of functional exercises. The results of this study showed that there was a decline in initial injuries, but there was still added benefits of quadriceps strengthening throughout the rehabilitation process. Here is an exercise of side-lying straight leg raises, which will help with hip strengthening and oftentimes can be progressed to sidestepping, shown here. Along with therapeutic exercises, modalities have been found to have no added effect to the treatment of patellofemoral pain syndrome. So what to expect at physical therapy for your treatment of your patellofemoral pain syndrome? There will be dynamic warm-up, stretching, could involve some foam rolling, knee strengthening, core strengthening, hip strengthening, balance training, and plyometric training.